how do we think about the governance of AI, right? I think that's a really big open question. Great. So like we have all the risk associated with medical records, privacy risk associated, and we're going to give it to a machine, right, computer that's going to develop some set of information that then going to be interpreted by a physician, right? You still need a licensed healthcare practitioner out there. But it leads to a really interesting question. And I think there's a corollary to this, right? In the self-driving car. And we have them here in the city in San Francisco. They're driving around, right, on their own. There's nobody in the car, but it's offering a taxi service. So when something happens with one of those cars, I still think there's a big question of like, who's actually liable? Like, is it the manufacturer of the automobile, right, that didn't anticipate some edge case, right? You kind of trying to figure out where the risk stops. And I think we're going to have a same issue with AI innovation in healthcare, right? Which is who's really responsible.
Yeah, it's a great corollary. I'm going to run with it. And I'm going to say that that's the big sea change that never was able to happen. The self-driving car in medicine is you. We need to build AIs that work for the patient. Today, we built AIs, we're so early, that are institutionally oriented. So really, I want an AI that's kind of a virtual doctor and that I can think with, right? Because my doctor, I'm happen to be in a zip code in a part of the country where the care is a little bit different, but by and large, doctors get 4 to 5 minutes in a 10 by 10 room with a patient. And that's it. And maybe a phone call with their, back office. By the way, to no fault of the doctor. They're incredibly busy. But today, you can actually use AI to say, what if I wanted to manage my hypothyroidism with holistic care or functional medicine versus, starting with pharmaceutical medicine? Or what if I wanted to pursue this pharmaceutical over that pharmaceutical? And that's where patients should be able to self-drive. So the first part of the problem was that they never had access to their own data. Companies like yours have solved that problem. That problem is now solved. You can actually get access to your own data, which is a phenomenal change. The second part of the problem is being able to process the data. And that problem solved with AI. So your self-driving example is a great one. In terms of the liability, I think liability goes away because oftentimes liability exists when you give agency to a steering wheel that's moving in the car and nobody's behind it, right? That's where liability happens. And I think we're close to putting the agency back into the patient. So patients could have their own agency. That didn't exist before. And that's really what the most exciting part of this whole time is that we're living in.
I love the patient centricity. That's like near and dear to everything I've worked on. I love that idea. Like I'm the self-driving vehicle. If you imagine that we don't have enough doctors, we don't have enough nurses, we don't have enough hospitals, clinics, we have a healthcare system that doesn't actually have the physical resources required to treat the population. And we have a runaway cost train, like completely runaway cost train, which we just have to, you don't even need the analytics to look at it. You just got to look at a bill that you get, which comes back to your house. If we could take a significant portion, I want to say large, but just a significant portion of the regular day-to-day healthcare interactions, right, that are routine, that are just reading. We were talking earlier about a guideline, like just what's in the guideline? How do I do this thing? Which most people would need to call their doctor or talk to this office staff or nurse with, and allow an AI just to provide the routine, preventive, educational care that we all need, by the way. I have questions all the time. I had to call my doctor. I'm like, I don't really know what to do. You're only there for the thing you absolutely need them for. So I can also imagine how boring it must be to be a trained physician and answer the same, because, we all think we're unique, right? I think I'm the most special person in the world, honestly, right?
Right.
So I think whatever's on my mind today is the most important thing. But I guarantee that the same question comes up over and over and over again. And at some point, these poor healthcare practitioners have just got to be like, I don't ever want to hear that question again. I just don't want to hear it.
This is why I came in. I really worked hard in this industry, starting in the first ever specialty pharmacy, Theracom, that came out of the Cystic Fibrosis Foundation in the mid-90s and moved over to Dr. Evidence and other things that I've done, where what you're talking about is the learning capital. I want to say two big things about this. One is the problem you just described is the learning capital. We found that health literacy is completely nonlinear to regular literacy. That is, that people that have actually the more literacy, this is an anecdotal fact, but the more literacy patients tend to have, the more they turn over agency to the system. So you find that people that don't have multiple degrees or advanced degrees, oftentimes their health literacy, that is the literacy of their disease, what works, what doesn't work, is generally very strong. So you might think about that as learning capital. That learning capital doesn't get shared patient to patient. That's kind of circles back to our early discussion. Whereas now you can have AI do that. Every time someone gets exhibited to a disease or gets diagnosed, they immediately would benefit from meeting, tons of patients like them, right? You could do that with AI because you can start at a lot higher rate. Think about it as S curves, problem curves. Everyone starts when they get diagnosed, they all learn the same thing early on in their disease. What if we lived in a world where you could start with the best knowledge in that disease? That's what AI enables us to do, number one. Technology really has three big phases: duplication, enhancement, and transformation. So take electronic medical records. We used to write them in a chart. It was called the one write system, where a doctor's office would have these medical things or these metal things, and they'd write it and it'd go down to 3 or 4 papers. We have electronic medical records. So that was a huge transformation. Then we were able to read the record a little bit, give patient notices, reminders, medication notices, show up at the office at a certain time. That would be more like, you're getting into enhancement. These are small examples of enhancement. Transformation would be, hey, you're being treated for this. There's this other treatment that has phenomenal outcomes. So it's constantly looking at data. And imagine if we were able to access all that data inside of pharmaceutical firewalls that I mentioned. It would be completely transformative. And that's the stage we're not at yet. That's the stage we're going to get to. We'll get there 5, 6, 10 years. We should really get there in a metric of months instead of years. So because we have everything in front of us to get there. When Avatar was made, it was said that, he wanted to make that movie 15 years before, but the tools didn't exist to make it. So the vision existed 15 years before the movie was made. And then finally, you had all the processing capability to make that, phenomenal movie, and it was made. So that's where we are, I think, in medicine right now.
So you just answered, maybe we'll just end with this here. The question that I get, which I'm still waiting for somebody to be able to produce the system that answers, right? And I hear this in various forms from every single patient that I've ever talked to, myself included. And it's a really simple question. It's really obvious, which is, what did people like me do in the same situation, and
Right.
did it work? Did it work? So tell me what other people did. And it's like a restaurant review, right? Or anything else. I just want to know, did this lead to a good outcome or not? Because I need to make that decision. And I agree with you. We're so close, Bob. I think we can see all the pieces now. Now it's just a question of putting it all in place and making it a reality.
That's right. And it's perfectly said. I mean, when you have anything from a little surgery or discomfort to something major, you start meeting people and the system's pretty efficient. Your friends, your family say, we knew someone that had this. Why don't you talk to them? All of those stories can go into AI. It's a phenomenal place that we're at in terms of transformation.
Primary way that if you look at patient advocacy, right, and navigation groups, right, and all of that other stuff is patients just sharing anecdotally their experiences with things like side effect management, best doctor to go to, who knows what, like all of this stuff. And we have a chance to do it.